Hey everyone, welcome to another edition of Island Ripple. I am Vanetta and we are at the beautiful Marinaville in Rodney Bay. Be sure to follow us on Instagram and Facebook at Island Ripple, and of course subscribe to our YouTube channel Cut TV for any interviews that you may have missed. So I am about to have a conversation with an interesting gentleman who has a lot to say about cancer research. And I am talking about none other than Dr. Aviane Auguste, who is a professor at McGill University, but he is St. Lucian. So welcome to Island Ripple.
Thank you, and thank you for having me.
Great. Okay, so of course, when somebody hears, okay, a doctor and a professor at a university, they're like, somebody's a little, I don't think you're stuffy, but somebody's a little stuffy, right? But it's already a proud thing to be St. Lucian and, going on the journey that you've gone on. So let us know where you start, where are you from St. Lucia, what part of St. Lucia, and how did you start on this journey of research and medicine and that sort of thing?
All right, well, good question. So I'm originally from, here in Grizzly, not too far from here.
Okay.
And so again, my journey, I did all of my studies in France, and that's not by chance. So I was very much invested and, interested in French and learning the language.
Right.
At a very early age, from, primary school, learning songs and whatnot. And I did that for CXC, did that for A-level as well, did quite good in it. And I was able to get a scholarship from the French government. So that was, back in 2011, and I started studying in Martinique, did my master's degree in France, and did my PhD in a French school with, in France. And then part of that research was in Guadeloupe, where I, specialized in cancer epidemiology. So my specialized in epidemiology, but really did a lot of research in trying to figure out what causes head and neck cancer in the French West Indies.
Okay.
But I was very much interested as well in finding solutions for home here in the English-speaking Caribbean, in St. Lucia and the rest of the islands, which, from what I observed, were very much neglected or ignored in the international scientific community. When we speak about the Caribbean, we hear all about the Greater Antilles and Jamaica, Barbados, Trinidad, the trio, but often in the OECS were often ignored. So a lot of my career has been aimed at trying to fill that gap, that scientific and knowledge gap, and see how we can better improve the lives of cancer patients in this region where, we have this inherent problem of medical travel, which other islands don't have. So we know of someone who's fallen sick who had to go to the United States, Canada, the UK, Martinique, Ghana, you name it. And when you go to the other islands, you go outside of this context, you hear that a bit less, which kind of shows the specificity in our small island context in the Eastern Caribbean that we don't necessarily know too much about in terms of like the quantifying how many people travel, where they travel. And so the research that we're doing like right now is kind of trying to figure out that and how to bring solutions to these patients.
Okay, great. But why medicine though? What drew you to medicine in the first place?
Yeah, so back at secondary school, so I went to Leon Hess Secondary School,
Okay. Yeah.
I don't say one of the best, but anyway, just plugging there for my
shameless plug-in, but that's fine. We love Leon Hess.
Yeah, and so I was very interested in sciences at an early age. I think I wanted to become a clinician early on, because a lot of people, they want to become a doctor, they want to either a doctor, lawyer. So I wasn't in the doctor path. So I did all three sciences, and A-level, I did chemistry and biology. And then, I was kind of unsure as to what I wanted to do with that. I realized that, the clinical work was not necessarily where I wanted to do. I know the scientific inquiry and that kind of level of work was something I was interested in.
Right.
And I was like, why not do biochemistry in French? So I kind of...
That's not a normal choice to do. Like, biochemistry in French, okay? Like, it's so normal, but
why not?
It's normal for you, right?
Yeah, it just felt very natural, and along the way I had some really good mentors that, at one point in time I told myself I want to become a lab technician, that was my aspiration, my dream. And then, professor at the time, was visiting St. Lucia back in 2011, Dr. Armand Brathwaite, Fulbright scholar, told me, I should, have you ever thought about doing a PhD? At that time I was like, me?
Yeah.
Little old me. I just started school as my first year undergraduate in biochemistry. What am I doing for PhD? Of all people, am I good enough for it? And then I think that conversation kind of planted a seed in my mind that made me realize it is possible. Why not aspire to that? And I think that kind of shifted my whole mindset of like the scientific research, and I thought it was something that I could have done. And here I am, 10 plus years later,
Yeah.
living that, fulfilling that, that dream.
Well, that's great. That's great. So, in regards to, because as you said, cancer is something, I mean, that plagues the Eastern Caribbean a lot. What new things, I know lots of things happen in science, but what new developments have happened, do you think, that we can use here in the OECS as we're looking at different cures for cancer?
Yeah, definitely. So that's a good question. So science is rapidly evolving. We started COVID. You have information that comes out today. Then a year later is no longer relevant because new things are coming out. So it's, cancer biology and cancer epidemiology is no exception. We have a lot of, novel therapies coming out, that can tap into the immune system and help, we call immunotherapy. So there are a lot of drugs that are coming out, for different types of cancers where they do improve survival. But the problem is that, it's not necessarily the creation of new innovative technology and therapies for cancer. Our context is more a question of access.
Yeah.
So we're going to see, comes out in the news, oh, there's this new immunotherapy drug, saves people, but then how are we getting the money to pay for that?
Yes.
How are we getting the supply chain to get those things to us? How are we going to procure the drugs? And it's a whole question, a whole system that's not necessarily built around to adopt these innovative technologies and therapies. And so we're kind of always lagging behind. So we consider that this is a disparity. And the work that I do is try to figure out how do we reduce those disparities? How do we close that gap between those countries who have and those who don't have? And so the Caribbean right now, Eastern Caribbean is kind of serving like a lab to kind of, identify those problems and get those solutions on a smaller scale and to see how they can be transposed in other contexts, other small islands around the world, whether it be in the Pacific, or the Indian Ocean, or, in Atlantic, so we're very much keen on trying to understand that.
Great. So before we get into what you're doing now, you're a professor at McGill University.
Yeah.
What is it that you teach, and how has that been going for you as a professor?
Well, it's been a great experience. I think I embraced the Canadian context, really well. I moved from France for this position, and there's a lot of adjusting, but I'm enjoying it so far. I teach 2 courses, one in fundamentals of epidemiology and a second course in cancer epidemiology. So a lot around the methods and trying to know how to use the right tools to build some studies that involve humans, so specifically to in a population level.
Okay.
And also part of my job includes service, so that would include anything that has to do with sitting on committees, or whether it be a mission committee, or whether it be organizing seminars in the department. So that falls on my responsibility and something that I take seriously and I really enjoy doing. And research would make up close to 70% of what we do as professors, and we try to be productive and have a decent outputs.
Great. Okay. So what is happening now with you in regards, I mean, you're back home, you're to and from, I'm thinking.
Yeah.
So what's happening that, our Island Ripple viewers need to know about?
Yeah, so currently in my research program, there's a portion that talks about cancer in the Eastern Caribbean, of course, and there's a study called the Cassidic study, which is really focused on trying to understand, like I mentioned earlier, the specificities of our context, which is that medical travel for cancer care.
Okay.
So we did a pilot survey back in 2019 that showed that 1 in 2 persons with cancer travel for cancer, which is a big number. It's not a minority, it's not marginal. So
yeah, that is a lot.
It does, with all the measures are imperfect, it might be a little bit less, maybe a bit more, but we know that this is a prominent feature of our treatment landscape. People do go out for care, but the thing is, when they go out, we don't have information on what happens over there.
Yeah, true.
We don't know if, is Martinique inherently better than Guyana, is Guyana better than Miami, and, so the study we're trying to do, try and kind of give, understand these phenomenon more and to better guide, decisions at every level. So the patient has to go, is diagnosed, where do I go? What's the best place to go?
What are the steps to
exactly.
follow? Yeah.
The clinician himself has to be able to advise. Should you go to Guyana? Should you go to Trinidad? He has to know how to advise. And the ministry level, we need to know, well, where should we invest? Should we subsidize care for Martinique, or should we subsidize care for the United States? Where should we put our dollar? What should we invest in? Should we build a cancer hospital in St. Lucia? Should it be an OCS cancer center? So these are questions that the research will allow us to answer and inform any kind of intervention that has to come out from that. And then ultimately, improve the lives of those persons who are affected by cancer, as well as, the caregivers, because they're also, we're not forgetting them,
Yeah.
we also want to include them into this study.
Okay, all right. And how long? What's the duration of the study that you're doing right now? And what will be the end results of it? Will you be presenting it to our health ministry down
Yeah.
here? What are your plans? If you can betray the plans,
No, no,
what
of
are your
course.
plans with that study?
So I didn't mention it, but so I'm a professor at McGill, but I also have a secondary affiliation at a local research institute, which is called Valeri, the Vaughan A. Lewis Institute for Research and Innovation. So, which is an institute created by SAFR to amplify indigenous research like this one. And so
Okay.
I work closely with the community college and hand in hand with the ministry and community groups, and oncologists there. So the idea is that we are currently actually thinking about how to disseminate that information. So the big, stakeholders are already aware of this research, and the plan is to roll out some form of, I don't want to say guidelines, we're not sure what shape that'll take yet, but we want to be able to disseminate this of a form that the patients and at all levels, clinicians, community groups, they have that kind of like a map of what to do
Yeah.
in a certain case. So you have breast cancer, whatever stage, well, this place, Guadalupe, Martinique, does it really well, go there. You have a
Right.
24%
Yeah.
chance to, more of survival versus someone who goes to, I don't know, Guyana. So these kind of information we want to be able to make available for the internet or through leaflets, and also again with presentations locally, because I'm really big on making this information impactful and giving something back to the community. We don't want to do research that sits on a shelf, of course. So we
Right.
really want to make sure that all stakeholders are involved from the beginning, and this study will last for 3 years, and hopefully we'll deliver all results 2 years afterwards. So,
Okay.
because it takes time to look at the data, make sure it's robust,
Yeah,
and
and do all of the nitty-gritties of
exactly,
things.
because we want
Yeah.
to give half, information that's kind of, haphazard. So we need to allow us around 2 years to really properly disseminate that information.
Okay, great. So aside from doing this study in St. Lucia, and of course what you want to do to give that to the Ministry of Health, do you have any other interest in regards to cancer research? I mean, everybody like, when you hear about, cancer, we're like, what's the cure? How could it be prevented? Have you ever looked into that direction at all in regards to research, or, to figure out a cure,
Yeah.
or how it can be easier before the person gets to the treatment stage? Because
Yeah.
we know that the treatment for cancer is invasive, and, so what are your thoughts on that?
So I do have a background in, biochemistry, but I have enough knowledge to understand the research, but I'm not
Okay.
actively working that area.
Okay.
I do work a lot in, cancer therapy, so we look a lot at prevention at different stages.
Okay.
We know, for example, physical activity before and during treatment
Yeah.
is really important to improve outcomes and for quality of life. So that is the literature does support that. They go as far as maybe trying to speak to different types of adapted activities for cancer patients to do,
Okay.
which I don't have on hand right now, but we can.
Okay.
But I
Yeah.
know physical activity and your diet for sure need to be adapted for when going through treatment.
Okay, okay, great. So as we wrap up, what would be your piece of advice for let's say a young person, aside from being from Leones, compared to, but somebody who wants to, pursue even your field,
Yeah.
or what you're teaching and so forth. What piece of advice could you give them?
So my path is a bit hard to reproduce because it's so
Yeah,
circuitous.
yeah.
But I think at the end of the day, you can have I mean, I have a clear vision of, I didn't wake up one morning and say, I want to become a professor at McGill.
Right,
But I
right.
think you need to be adequately prepared for these opportunities when they come.
Yeah.
So I want to say, you need to be very assiduous, very regular at your schoolwork. You need to have a good. You need to actually be curious, because scientists are naturally curious. You need to be able to ask the right questions.
Yeah.
And be resilient, because the path, I didn't fall here by chance. So resilience and curiosity, I think, are two qualities that you definitely need if you want to get into a scientific field.
So how do we connect with you on social media? How do we find out more information about your research?
Right, so you can contact me personally through email. I type in Aviane Auguste and you can get me, my McGill page is there. If you are in St. Lucia or any of the member states of the OECS, you can visit our Facebook page. You type in Cassidic Study into Facebook and we pop up. Our pages, we are trying to populate as much as possible.
Okay.
And there's also a generic email, cassidic@valir, VALIR org that you can send an email, and then there's different, once you reach there you can get a way to contact us or enroll in the study, or
Okay.
so there's all the information is on the Facebook page and we're glad to respond to you.
Okay, great. Well, Dr. Auguste, thank you very, very much for visiting us here on Island Ripple, and we wish you all the best on your research.
Thank you very much.
Okay, so we've come to the end of another interview here at Island Ripple. Remember to subscribe to our channel, Cut TV, if you have missed any of our episodes, and follow us on Instagram and Facebook at Island Ripple, and of course TikTok. Remember, a little knowledge goes a long way. Pass it on, because that's the ripple effect. My name is Vanetta, and we will see you next time. I am being dressed and styled by Wings of Love at the Dream Plaza in Rodney Bay.